What did you call it? TMS? What does it stand for?
Transcranial magnetic stimulation.
Okay, and this is specifically for people who have depression that other treatments don't solve.
Exactly. It's for treatment-resistant depression.
Okay.
So most of our patients have tried, at least 3 or 4, some, 18 different antidepressants that haven't worked, or the side effects are so bad that they can't tolerate them. So, so it's a super effective treatment.
And how many times do they need to have this treatment to see the positive effect?
Yeah. So the normal protocol is 36 treatments. And so patients come in every day, 5 days a week for 6 weeks. And the depression treatment takes about 20 minutes. And then the 7th week, they start tapering. So they come in three days the 7th week, 2 days the 8th week, and 1 day the 9th week as they taper off. So each day, the neurotransmission process gets stimulated 3,000 times. And so over the course of those 36 treatments, it gets stimulated over 100,000 times. So
what do you notice? You just notice a boost in mood? How do you measure the impact of this?
Yeah, so we use the PHQ-9, which is an objective measure that is pretty standardized in mental health, and it's the criteria that insurance companies use to assess to determine eligibility, and then also the efficacy of the treatment. So every Wednesday we give all of our patients a PHQ-9 and monitor their scores across time.
And is it like a self-assessment?
It is. It's a self-assessment that addresses the different aspects of clinical depression. So, little interest and pleasure in doing things, difficulty concentrating, sleep disturbance, depressed mood, those kinds of things. And so it assesses how much that's going on.
This is very, very interesting because I know someone who is, I don't know clinically, but she's depressed for a long time. And we are trying so many different approaches and none of it is working, zero, none of it.
Well, and
that's why I'm so interested in what you're saying.
Yeah. Well, you've got 2 aspects to depression and anxiety, right? You've got psychological and emotional health, your coping skills, your cognitive functioning, all those kinds of things, the quality of your relationships. And then you've got brain health. And a lot of times people don't differentiate those. They certainly, reciprocally influence each other. But if your brain isn't working, it's really hard to be emotionally healthy. And, doing therapy for 20 plus years, I was constantly dealing with the struggles of that. And I'd have people that were living really, really well, but their brains weren't working. And so you can't just power through biology. If physiologically your brain isn't working well, the neurotransmission process isn't working well, there's not a lot you can do about it until
I have more questions. So question number 1 is, if someone is starting to have, let's say, dementia or Alzheimer's, would this have a positive impact?
Good question. And yes. So I actually just read a study recently looking at memory recall in the elderly, and TMS had very positive effects. So neurotransmitters, there are 2 different categories of neurotransmitters. There are excitatory neurotransmitters, dopamine and norepinephrine, and they are responsible for motivation, memory recall, drive, get up and go, sex drive. They're like the gas pedal. Neurotransmitters are like little mailmen in the brain. And so if we need to have some motivation to study, then the brain will send out an excitatory neurotransmitter to help increase that activity. The other category are inhibitory neurotransmitters, serotonin and Gaba, and they do just the opposite. They work like the brake pedal in the brain. And so they help with sleep, relaxation, feelings of contentedness, calmness. They slow down the brain so that we can bring up information. They help us be able to focus. And so in order for our brains to be working well, we have to have healthy levels of both excitatory and inhibitory. And so anything, ADHD, memory, again, sex drive, depression, anxiety, OCD. There's a bipolar protocol that's working through the FDA right now. Anything that is affected by neurotransmitters is positively affected by TMS.
So I'm still asking you questions.
Yeah.
A question is, how does a person's brain start to malfunction? Like, what happens?
Yeah.
Like, you're perfectly fine, you're healthy. And I'm not even talking about Alzheimer's or something
Right.
like that, but just how does a brain get from fine to
Working
depressed?
well. Yeah. So a couple of different things there. So in order for our brains to be working well, there are two things that have to happen. The first one is that we have to have healthy levels of neurotransmitters. And our brains use moderate exercise, healthy nutrition, and adequate sleep to produce neurotransmitters. And so, and the older we get, the more environmentally dependent we are on the production of those neurotransmitters. And so, if you're 20, you can get away with not doing those things as well and still have pretty healthy levels of serotonin and dopamine, et cetera. But if you're 60 or 50, you're much more environmentally dependent. And so if somebody isn't doing those things, then the brain doesn't have the building blocks that it needs to be able to produce neurotransmitters. And then the other thing that the brain needs is the neurotransmission process has to be working. And that works. Neurotransmitters are housed in little membrane sacs called vesicles in a neuron or a nerve ending. Here's a little diagram of it. And so they're housed in a neuron in these little tiny vesicles, and an electrical pulse tells this neuron to send the neurotransmitter. So it pulses and it sends that little vesicle up, and the vesicle gives way and it releases the neurotransmitter into the little space between cells called the synapse, where it's caught up by the receiving cell. It gets re-encapsulated and it awaits the next electrical pulse over here to go on through the brain. And so, there's some evidence that there's a genetic component. The research suggests that there's about 1% of the population for whom that neurotransmission process just doesn't work. For 99% of us, most of the time, if we have healthy levels of neurotransmitters and we get the brain going, then it keeps going. In fact, the national results on TMS show that at the end of the initial round of treatment, it's working for about 65% of the people. But at the end of a year later, without any additional treatment, it goes up to almost 70%. Yeah. So once the brain gets going, it tends to keep going. And so what TMS does, since that electrical activity isn't functioning well when we're depressed, TMS provides the electrical pulse using gentle magnetic pulses about the same as an MRI machine to stimulate the neurotransmission process. So they come in, and in 20 minutes, that neurotransmission process gets stimulated 3,000 times. So it's sending the neurotransmitters through the brain 3,000 times every treatment. And
so a person is conscious when they're getting these treatments?
Absolutely, yeah. So before we started recording, you asked a good question about ECT. ECT is like turning off the breaker and turning it back on. You actually induce a seizure and then jolt the brain back on. And so it is. And
for people who are listening, ECT is tell me what it
convulsive electroconvulsive therapy, compulsive shock therapy. And it comes with lots of side effects. You have to be taken there, lots of short-term memory loss. It's an effective tool to get the neurotransmission process working, but it's a really costly tool in terms of the price tag, and not just not just monetarily, but emotionally and relationally. TMS, you can drive yourself there, drive yourself back. Where medications have all kinds of known side effects from, insomnia, headache and migraine, dry mouth, sexual dysfunction, nausea, heartburn.
What about like numbness, emotional numbness?
That's one of the side effects that people on medication complain most about. You'd have none of that with TMS. The only side effect that you have with TMS is some site pain or discomfort during the first week of treatment.
Mm-hmm. One more question.
Yeah.
Promise.
No, you're good.
No, I never promised that. I only.
Well, and it's interesting. I can talk about this stuff all day, Kim.
So 6 weeks, then in the 7th week, in the 8th week, in the 9th week, it tapers down. Well, what if somebody like just does it for 1 week? Because chances are, they're a runner. They don't stick anything out, right? Right. So would it still have a positive effect?
Well, so what happens, and that's a really good question too. So the typical kind of path for a patient is by the end of the first week, several people are starting to experience some positive results, but most people are not experiencing a lot of positive results. At the end of the second week, more people are starting to feel a little bit better. And then during the third week, there's what's called the dip. And most people experience a regression, a return to baseline during that third week. We're not really sure why. I think it's because our brains aren't used to being happy. Our brains aren't used to functioning. Those neurons aren't used to functioning. And our brains try so hard to maintain homeostasis that I think as we start to feel good, our brains fight that. And during that third week, there's like this hanging on. And then as they enter the fourth week, that's when they start really taking off. And from the fourth week on, they just feel better and better and better. And
yeah, it's interesting what you say, because in my language or in my kind of comprehension of that, people hold on to negative feelings sometimes because it's safe.
Right.
Why? Known. I don't know, but it's safe.
It's known, right? Yeah. And a lot of times a known misery is more desirable than the unknown. And that works, fascinatingly, that works on a physiological level as well as a psychological level. And so there are some experiments that are going on now. There's a group in Stanford that's looking at some different variations of the treatment, but the FDA approved protocol is that 36 9-week treatment protocol. And the national results, like I said, are over 60%. My clinic here at TMS Success, our results are over 91%.
Wow.
9 out of every 10 of our patients are reaching remission from their depressive symptoms.
Incredible.
Amazing.
And what's the average age of a person that you're seeing? Is it an older person, a younger person? What's your average?
That's a good question. I could look up that. I haven't looked at the demographics of that. Just anecdotally, I think the majority of our patients are in their 40s and 50s.
Okay.
We've treated some adolescents, treated several in their early 20s, and we've treated several in every category. But by the time somebody gets into their 40s and their 50s, after struggling with depression for decades, they get so frustrated and desperate, and so they're really looking for some effective alternative.
Right.
So that's where most of our patients come from.
Now, do you also treat trauma-induced depression?
So again, it's kind of differentiating. The answer is yes, but it's not necessarily in the same kind of way. So with depression, I can't remember if this was when we were recording or not, Kim, you'll have to remind me, but when you look at depression, there are two aspects. There is the psychological, emotional depression, and then there is the brain health. And TMS doesn't do anything directly with the psychological functioning, coping skills, or like working through the emotional trauma of, whatever the trauma might be. TMS affects the brain health. it gets the brain doing what the brain is supposed to be doing. And so does it affect trauma-induced depression? Yes, but not by directly dealing with the trauma, but by getting the brain functioning well.
Well, it sounds like if you get the brain functioning well, then a healthy brain can somehow deal with the trauma.
Absolutely.
Right? But a non-functioning brain, there's just no way. Like they just can't get past it.
Exactly. It's really hard. I mean, I did a consultation with a guy yesterday, and he is like, I love my family. Of course I love my family. When I'm depressed, I don't even care. I don't care if they're okay. I don't care if they're okay with me. I just don't care. And then I feel guilty that I don't care, but I don't feel guilty enough because I'm too depressed, And so it is really hard to live and cope well when our brain health isn't good.
I'm going to ask you a totally different question.
Yeah.
How are you affected by treating so many people who are depressed?
It is awesome. Like I said, I was a therapist for over 20 years, and now I do coaching. And so I've dealt with depression and anxiety, used to deal with, more severe mental illness, and for years, decades. And it is so awesome to watch somebody go from the first day of treatment to the end of treatment with TMS. And they're, little things like, they might start wearing makeup, or they might be, dressing a little nicer, or just smiling, or combing their hair, or, you can just see the happiness come back. And again, the guy that I was talking about, that I talked to yesterday, said it'd just be so nice to feel like myself again. And
you take Canadians?
We take anybody. So actually we had some, so we're in Utah, for those that are listening, Southern Utah. We actually had a patient come here from Texas, and they didn't have a good alternative where she lived in Texas. And so she got an Airbnb and came up here, and we did her 36 treatments straight through while she had that Airbnb. And then she went home, and she experienced tremendous benefit and results in her treatment. So the answer is yes, we do take Canadians.
What's the weather like in Utah right around now?
Well, I'll tell you what, a week and a half ago, it was 73 degrees. And we're in a bit of a cold front right now. So right now it's only 46 outside.
But I don't feel bad for you.
I know. Yes. It's better than Toronto, I'm sure.
Yeah. Like it's been really cold this winter. So I'm guessing cold weather and dark days kind of
course, the seasonal affective stuff.
Yeah.
We have one patient. So most of the patients that we've treated have not come back. We have, I think we've retreated 3. The research shows that if TMS worked well the first time, and worked well is defined as at least a 50% decrease in depressive symptoms, then the likelihood of it working even better the next time is really good. And we have one patient that we have treated 3 times who really struggles with seasonal affect disorder. And right about October, he really starts to struggle and tank. And it's been interesting that each of those times, his end result has been higher, and it has lasted longer. And so his brain appears to be learning how to continue to stay firing well. But
I'm going to ask you maybe an inappropriate question, but how much does it cost to get this kind of treatment?
It's not inappropriate at all. So TMS was FDA approved in 2008, and which means that insurance will pay for major depressive disorder. We also do an anxiety treatment here. There is an OCD protocol. Like I said, there's a bipolar protocol coming out, and so it's expensive. I have to pay every time I turn the machine on. So the cash price for 36 treatments is $10,000. Because it's 36 treatments, and it's a commitment. But if you've got a 90% chance of remission,
Yeah.
you know, you start putting a price tag on how much your depression is costing you, and missed work and missed
Wow.
opportunities.
Missed life, never mind
Right.
missed work.
Yeah. So it doesn't take too long to have $10,000 be worth it.
Yeah. Interesting.
Yeah.
Very interesting. I learned something new today and I appreciate it.
Yeah. Really cool. You had really good questions. And I do want to introduce you. This is Kim. Is it Ades or how do you?
It's Ades. Ades. Yeah.
I threw my little Spanish on there. And Kim, you want to just take a second and introduce yourself?
Sure. So I'm Kim. I am the president and founder of a company called Frame of Mind Coaching. And we coach executives, leaders, entrepreneurs, really across the world. We have a team of coaches in Canada and the US. And we've been doing that for quite a long time. And we also recently launched something new called the Journal That Talks Back, which is essentially a coaching service for young professionals. And we did that at the tail end of last year. We're excited to talk about it, but it's a longer conversation, I'm sure. But yeah. I'm thrilled to meet you, and I'm thrilled to learn about what you do. I think it's very interesting. I am so sorry that you're not in Toronto and that we can't access your services more easily, because I have a client for you immediately.
Right. Yeah. It would be nice if we were there. I will look and see what TMS options are there for you. I've really enjoyed visiting with you. You've been delightful. And
how do people find you? Because that's really the question of the day.
Yeah. So become.healthy.happy on Instagram, Denim Slade, PhD on Facebook, got the YouTube channel. So yeah, then the TMS is tmssuccess.com. And the healthy and happy is denimslade.com. So yeah. And how do people find you?
Frameofmindcoaching.com or thejournalthattalksback.com. But also I'm everywhere. I just Google my name, Kim Ades, Ades, and I'm all over the place.
Yeah, and it can be really difficult to find good help that you can trust. And just in the little bit that I know, Kim has really great stuff. And if you're looking for help, I really encourage you to check out her stuff and get the help that she's offering, and that her team is offering. So
well, maybe we'll visit again next time. We'll talk a little more.